want to welcome everyone. So my name is Vishwanath. I'm Lee Kum Sheung, Professor of Health Communication at the School of Public Health and Professor of Population Sciences at the Dana-Farber Cancer Institute. I'm also the Director for the Lee Kum Sheung Center for Health and Happiness, which is the sponsor for this seminar. We have the center itself does a number of programs, as some of you are familiar with, a number of outreach programs, as well as research and translation. So our monthly seminar series is one manifestation of our program of activities. Every year, we choose a particular theme to focus as a part of our seminar series, especially given the recent focus around translation, and by translation I mean how do we take research that is developed and generated in controlled settings to influence policy and practice. That has been a significant areas of focus for the center over the last 3 years or so. And so we have held a number of these seminars. First year, under that regime, we had a seminar on social media, seminar series. This year and last year, we had it on loneliness. And this year, we are starting a series on urban health, green space, and climate change, broadly around that area. And I cannot think of a better person to speak about that topic, Dr. Ivey Boufford, who is a clinical professor of global public health at the New York University School of Global Public Health. But that's only a technical title. Joe is active all over the world, doing a variety of things on urban public health. In fact, she is Dr. Urban Public Health in many ways, defined the area, consults with a number of international organizations around these issues, works in many parts of the world, including Africa, and has been a thought leader in this area. So I couldn't be more pleased that, Joe, you were able to come and start off this seminar series. She's also on the Board of Scientific Advisors, or Scientific Advisory Board for the Center for Health and Happiness, a kindred spirit, because among all the positive psychologists who study happiness, at least there's one person who can speak the sociological language in the form of urban health. So welcome. Thank you so much for joining us.
Very much.
I also want to acknowledge there are people online who have joined this call. So, but after the talk, we'll take some questions from here. And before I end and hand it over, I want to thank my team who has been working very hard behind the scenes, who have arranged these seminar series and this visit. Thank you, everyone.
Thanks. I have to turn this on too, maybe. Sorry. Thank you very much, and good afternoon to everybody. It's really a pleasure to be here. When I first got invited, when Vish called me and said, would you like to speak to our group, I said, I can't do it, I'm not a researcher. And he said, no, we're broadening our focus to deal with application and intervention. And I said, well, I'm a consumer of evidence. And most of my work has been in policy and management. So that's the premise in which I'm talking today. And I hope I'm going to make the case for getting you all, or having you all continue to be super interested in urban health. I think I can do that. My work on urban happiness is going to be a little bit more hypothetical. I'm going to pose some realities and some issues and leave it in the hands of our research colleagues to, as you are already taking it forward. So it's exciting to introduce it here. So let me start. One of the things I always like to do is to start with definitions, because I think we throw a lot of definitions around and we may not know what we're talking about. So I'm going to give you 3 definitions to start with so you'll know what I'm talking about during this talk. I use the WHO definition of health, which is quite broad, but my major interest in it are the second and fourth bullets. The second one is really the clarification that the right and the enjoyment of the highest attainable standard of health is really what WHO is shooting for. And the fourth bullet says government has a responsibility to create the conditions in which people can be as healthy as they can be. And it acknowledges perhaps unchangeable differences in health status that people are able to achieve no matter what one does, but it also acknowledges the responsibility of government to give everybody the best chance to make the healthy choices. And I want that's kind of the premise of really talking about cities and really talking about governance issues, which become really important in advocating for urban health. These are the next two. I did not comb the literature. I'm sure there are 5,000 definitions of happiness and well-being. I'm using this one on happiness. I'll use it again later when I segue into the last and much shorter part of this conversation. But I think the idea, I wanted to bring up the word well-being. I was saying to colleagues as we were warming up here, I have a problem with the word well-being because as somebody who's been working on urban health since about 2004, when you use the word health, everybody thinks you're talking about healthcare, whether it's in the United States or whether it's global, et cetera. It's changing a little bit, but not much. So I want to be really precise about the language. I am not talking about healthcare. I'm talking about health, which is why I started with that definition. I think we're just beginning to turn the corner. A very wise person said to me a few years ago, if you get the word urban and health together in the same sentence, you've succeeded, you can retire. It hasn't happened yet, so I'm still flogging it. But we're really beginning to understand health in the broadest sense, as opposed to only in the issue of clinical care, when the word well-being started getting used all the time. And from my perspective, my narrow perspective, and again, all respect to those that like the word well-being, it made it harder for us to keep talking about health, because health is part of well-being, and then everybody defines it differently, and then you can kind of sit back and say, oh, this is a cool new thing we're dealing with. And I just want to raise that, because you will not hear the word well-being any longer in this talk. But that's not that it isn't important. It's just not going to talk about it. So let me first start by kind of situating where I see urbanization and urban health. These are sort of what I would argue are the major public health challenges for this century, urbanization being one. Epidemiologic shifts towards chronic disease from infectious disease. COVID kind of threw us all off our rhythm. We were beginning to get some attention to chronic disease and chronic disease prevention, and I think now there's nothing like a good epidemic to get people refocused on infectious disease. Demographic shifts are the issue of aging and longevity, and as I like to say, aging is a good thing when you consider the alternative. And it's a public health victory, really, when you think about people living longer across the world. Whereas when you only think about health care or services, you think about, oh my God, the Medicare system's going to crash, Social Security is going to crash, the pension system's going to crash, et cetera. So you see how important the language is in what we're talking about relative to the paradigm. And climate change is really crucial for cities. Most cities are on bodies of water. The issue of sea level rise. Heat is a special issue in cities. There's a whole group of people who work on nothing but this, and I'll tell you about a conference at the end that's happening shortly where the theme is climate in cities. So I would argue that the fun part about cities and urban health is everything comes together in cities, and it comes together in a way that is kind of visible. The public and communities can engage and see whether the elected officials and those that are leading those cities are actually doing what they say they're going to do, whereas it's a little harder to do that nationally and certainly very challenging globally. So why did people get interested in cities? You can debate the actual crossover point when more than half the world's population live in cities. The projection 2035 is it'll be 75%, and that when everybody began to realize that this was not just a problem of the global north, but was a global problem, it became something that had to be dealt with by the global community. And that was a really big shift in the thinking. And in fact, if we got into that further in the curve, you'd see the steepest slope on the rate of urbanization is in the global south at this point in time. As my friends say, I won't go into that, will be simple. So anyway, so the question for us, for me, especially as a global health person, is can you reach global health goals? Can you achieve the SDGs if you don't pay attention to the health of cities? And the answer, I think, is no. And the reason for that is that while cities are really usually the concentration of GDP in a particular country, they're centers of culture, of media, of education, for targets for migration, they're also responsible for over a majority, really, of the world's energy consumption, greenhouse gas emissions, and solid waste production. So you can see how what happens in cities really determines the ability to achieve our global health goals. This is a diagram. It's a very iconic diagram from Wilkinson et al. Back, I think it's 1993 or something, 1991. We're still working on it, but at any rate, I think the idea is that if we really are trying to deal with the complexity of cities and the complexity of solving the problems of health, broadly defined, we've got to work at multiple levels. And this diagram reflects those nicely. I think you get in the center is the individual surrounded by their family who live in communities where there are different conditions to which they're exposed and different opportunities they have. And then those communities are very much shaped by broader policies, socioeconomic policies, culture, environmental policies that create the conditions, back to the WHO definition, which people can be as healthy as they can be, or not. And that's really the challenge of the work. And we have developed this diagram. This is an International Society for Urban Health diagram, which is popping up in lots of places, but we've lost the attribution, but I only bring it up because the effort was to really give you a sense of what is involved in making cities healthy. So this is the broader determinants of health. You can see that the health sector is the red person over here in the corner, which is the clinical system and arguably the public health system, although the new public health is supposed to be reaching out and connecting the dots with other sectors. And what's happened over the last 20 or 30 years, I think really thanks to Sir Michael Marmot's work on the Social Commission for Determinants of Health for WHO, now a little over 20 years ago, and others, is we begin to have an evidence base for saying that changes in these other sectors probably have more influence on a person's health than their access to health care. This varies percentage-wise. In the U.S., we know it's more like 10% of avoidable morbidity, more avoidable mortality is related to health care access. That will be a higher number probably in countries that have a less well-developed healthcare system, but the rest of it is about what happens in these other sectors, in the built-in natural environment, and the conditions in which economic conditions in which people live. So a couple of examples of what I call health influencing sectors that we need to bring on board in our conversations. Transportation is my favorite because a lot of my colleagues who work in urban health lead with transportation, and the reason they do is when they go to talk to mayors about advocating urban health, the fact of the matter is everybody breathes in a city. And if you go in saying we've got to get rid of cars, we've got to do this, there's rich people, there are people that are closer to the mayor, there's more political difficulty and challenge. And so leading with air pollution, leading with the transportation sector has proven to be very, very successful. So a lot of the global programs are air quality, water quality, et cetera, because it's for everybody in the city, and this is important. Transportation, obviously a car approach to transportation not only has pollution implications, but road traffic accidents, knocking off pedestrians, crowding, some work on traffic crowding, and increased stress has been shown to be related to higher risk in cardiovascular disease, not to mention air pollution and cardiovascular disease. So these are all why the transportation sector is important. Quick comment about urban planning. Urban planning colleagues are really, really easy to talk to in this process, and many of them, it's really fun to have this conversation with them because they're the ones who really worry about green space and blue space and placement of buildings. And many of them will say to you, our profession was really started to make cities healthier back in the 30s and earlier than that, and we went sort of towards engineering and architecture and the technical solutions and lost our roots. So many of them are really happy to come back into this conversation, especially in the urban space. And then the two I want to highlight, because I'm going to say a word about each one of them. One is community cohesion, which is really an interesting, it's an important phenomenon, I think, in public health. We're increasingly realizing that in achieving any change. But it's also really great in cities because, as I said, your constituents, if you're a mayor, your constituents are, as they say, in your face. Whereas if you're in national government or otherwise you imagine or you bring three people in representing, quote unquote, the community, or nonprofits who can often do something like that, but are often sometimes elite nonprofits bringing those messages, and those are the challenges that we face. And so the approach here of getting all of these folks to think about choices to promote health or not is what we call a health in all policies approach. You've probably heard of this. The Finns were the first ones to talk about this about 30 years ago. They wrote a book about it. It's finally catching on, I think. And the message here, again, the top line is really important because if you only talk about health care, you're only talking, the World Bank 1993 report was the first time health even got into international development conversations. It's a cost center. It's making countries broke. It's keeping money out of education, out of housing, out of everything else because it's a public sector cost. Whereas if you talk about health, you realize that you're investing in the productivity of your citizens, their ability to engage civically, their ability to manage their lives, their notion that they will live longer, their kids will live longer, they want education, they need jobs, et cetera. So it's a different kind of investment. And I must say this understanding is much more prevalent in the global south and the leadership in the global south than in the global north, where we're just so dominated by the healthcare system. So it is a paradigm shift in this regard, which is why I push the issue, the notion that all government policies have an impact, positive or negative, on health, and those decisions can be made, or political leaders can help their colleagues make them by making this a signature of their work. And then needing to collaborate across government agencies and with the private sector. So these are sort of principles of health in all policies. You can see them written up differently, but it's the idea that really supports the notion of working intersectorally. The other two areas that come in, and I wanted to talk about governance for a minute, that's on my bubble chart. I want to define governance, which is this alignment of multiple actors and interests to promote collective action towards an agreed upon goal. This is tough. And it's governance, it's not government. Often government convenes these multiple actors to get agreement on a way forward, especially now, and this is really true in global health and I think increasingly in public health. And government, there are international standards for what governments are supposed to be doing. But governance is always local because the stakeholders are different. So if you have a governance group going on, there's no such thing as these people must be at the table. The issue is who needs to be at the table in that location for that city to really deal with the issues. And I think that's an important thing. And then the question of trust comes in, and trust is really important. We know that from our recent sad experiences in public health with COVID for lots of reasons, complex reasons. But interestingly, when I was sort of looking at the trust information, it was interesting. This is a quote from James Madison's Federalist Papers to defining trust. That this assured reliance on character, ability, strength, or truth of someone or something. And the argument is without systems-based trust in our institutions, it's very hard to have a liberal democracy. And I think part of what we're experiencing now in the United States is this question of trust. I mean, who's telling the truth, who's lying, who will deliver, who won't deliver. This is a really important issue, and it comes up in the issue of cultures across countries looking at health and looking at happiness. UN Development Program, UNDP, is the sort of agency on the ground in most countries. They have identified these areas of trust that they look at, and they do a trust index. I'm not going to go into that here. There's an index for everything these days. So, but UNDP really is the sort of primum inter pares in countries relative to the UN. And the Pew Research Center did a study in 2019 of trust in U.S. institutions, which was very low and obviously varies by race, ethnicity, economic class, et cetera. So these are not surprising to anybody who's living here, really. This is the other area I wanted to focus on is public participation, community engagement. CBPR, community-based participatory research, is very familiar in academic institutions. Many people who were doing that 20 years ago were seen as renegades. Nobody thought it was valid. You couldn't get a dime out of NIH for it, right? And now it's like everybody's into it. It's great. I do CBPR, and I'm going to get tenure, which is good. The change is good. But there are also this is again from other sectors. This is from the International Association of Public Participation, which kind of looks at grading community engagement, grading social participation on different dimensions. I only put this up here to say that we can sort of decide where we're going to work on this continuum or other continuums relative to informing the public about what's going on, to actually engaging them, as CPPR tries to do really in the design, in the implementation, and the evaluation of what we're up to. And obviously on the far right with this group would be the goal of international development, which is turning the program over to the public, to the community in the end. So those are the two other areas I want to focus on. SDGs, I want to bring them to your attention. Sustainable Development Goals, all countries are supposed to be working on these. The predecessor MDGs was only the poor countries. The rich countries didn't have to do it. Now everybody's supposed to be working to achieve these goals. Goal 3 is the health goal, which is WHO, public health. Goal 11 is the city goal. It's the urban goal. And it was put there because of this realization that urbanization is a global phenomenon and needs to be attention. Big political debate because it's a subnational thing. Cities are under national governments. Most UN agencies work with national governments, so, but it's there, and it's really important. And then the other one I want to highlight is, because it's very relevant to urban health, is the issue of partnership. The UN and the global community calling for private sector engagement in order to achieve the social development, the sustainable development goals, not just their money, but also their know-how in various areas. And this still is not something that's widely accepted by many people in the public health community, but the international community has been requesting it. These are the elements of SDG 11. If you remember the wheel diagram I showed you, you will recognize housing, transportation, air quality. These are all the issues that are in that circular diagram at cities that have to be dealt with by cities. You will not see the word health anywhere in SDG 11. Arguably, these are the determinants of health. You will not see urban in SDG 3. So part of the issue is how do we get urban and health together, and happily UN Habitat and WHO are working much more closely together than ever before over the last several years. We've had a number of really important joint reports, especially a post-COVID report that they did together on cities. The New Urban Agenda is what UN Habitat, which is, they own SDG 11. They are the planners and the people who worry about housing and shelter worldwide. And the elements of the New Urban Agenda are this. And I think I wanted to mention only that because UN Habitat has not been that strong an agency historically, and urbanization was considered such an important issue, that the issue of urbanization is now a one UN effort. So globally, people are recognizing the need to deal with the issue of urbanization, health being one of the dimensions of that, and reporting directly to the Secretary General. So there is nothing is mandatory in the UN, but ideally there is a reporting requirement for countries to report, to create a national urban plan, report on it annually, and every 4 years there's a meeting to see what the progress is. The last one was in 2023. About 45% of countries had in fact developed a national urban plan. So you can see there's progress to be made. And one of the messages in that assessment was that nation states need to be more supportive of delegating authority and responsibility to local government as part of the agenda. Cities and urban health really probably came to everybody's consciousness during COVID. This is a nice report that was put out by UN Habitat and WHO right after the epidemic ended, really looking at what were the learnings here. You can see the list of activities. And I think none of these that are on this list, the last one with a health lens on urban infrastructure is like health and all policies. This is the second part. And the governance mechanisms were recognized as really important. Obviously, there were failures in alignment between national, local, and community messaging, as well as political intent. And a lot of the issues of inequities around first responders, essential workers, et cetera, crowding in housing, lack of access to broadband, et cetera, et cetera. None of these were surprises to people working in urban health or working in cities. And there had been an effort to try to bring them to the attention of people in authority for a very long time. And everybody was very excited and thought maybe there's a window of opportunity to address these issues. I don't want to be Debbie Downer here, but I don't think anybody thinks that's really happened. I think where the global energy has gone is the Pandemic Preparedness Treaty, which has been negotiated dealing with important issues, access to healthcare, access to medicines, access to vaccines, et cetera. It sort of bogged down last week, as I understand it from colleagues who've been following it closely. But to my knowledge, there's not been an analogous, nor is there money, because it's all going into keeping us all from catching something again. Sorry for being cynical. Rather than going into housing or transportation policy or other issues. And so it's just the way it goes, but I think being advocates in the urban space is really creating some room underneath this global issue. These are unique characteristics of urban environments, if you think about it. People talk about the difference between urban and rural. And Sandro Galea, who is just leaving Boston to go out and start a new School of Public Health, and David Blahoff worked together at the New York Academy of Medicine and really put this out initially as a framework for people thinking about research in urban health and practice in urban health. And I would just say that the message of these is that, as they say, in moderation, all of these are great. Even the density issue, there's a lot of debate about COVID, whether the density was an advantage or a disadvantage, and you get nice papers that were peer-reviewed and published on both points of view. And I think I want to just touch really quickly on each of these, because I think urban health, we also, just like aging, want to be positive. Urban health is positive. Living in cities can be positive. So just quickly on this. This is a colleague from Germany, Mazda Otley, who's a psychiatrist, and he's been looking at, he's created a term called neurourbanism, which I think is kind of cool, mainly focusing on the environment in cities and obviously on the urban planning issues, green space, blue space. But his findings, he does imaging of the amygdala, which I will not go into. It's a really interesting study. He's very serious about this. And obviously these are two, if you will, when density becomes crowding, people are not able to control their environments is really the point here, and similarly with social isolation. So these two extremes are problematic relative to the density issue, the planning issue, that part of the reality of working in cities, and create stress. Why is it this turn? Oh, there we go. The second one is diversity. This is why a lot of people love cities, right? You want to come to a city because you get all this diversity. It creates challenges for public health professionals, for educators, for healthcare delivery. This is Queens. This is from 2020. My guess is there's probably more languages now than there were then. But it's fun. I mean, that's why people love New York. I'm sure it's why people love parts of Boston, or you decide to stay away from cities because this is too much. I want, everybody to be a little bit more aligned. Complexity is another one. If I showed you, I looked at the health department tables of organization and the ministries of health tables of organization in a number of places, even in developing countries, and they're all incredibly complex and incredibly vertical and incredibly unsuited to doing any of the things that we're talking about as a health department, except collaborating with others, hopefully. This is from New York City 2050, which was an initiative started by Michael Bloomberg, who, coming from business, said we should have a strategic plan for a city. What's wrong with that? Just because elections change doesn't mean it's going to disappear. And sure enough, it didn't really disappear at all. So this is just a scheme of how they want to address the digital infrastructure in New York City going forward. And then lastly, this issue of inequity, which is probably a familiar diagram. Between 77 and 85 years is an 8-year difference in life expectancy and about 4 subway stops in New York City. Michael Marmot's done this for East and West London. I mean, the issue being that your zip code is probably more determinative of your health than your genetic code. And again, this is something that people who work in cities, do research in cities, you don't have to remind them. I've never heard a presentation on urban health where you had to say, but what about equity? But what about diversity? But what about disparities? Because they know that if they round up the data, you're not going to know anything about what to do about a problem in a city. And the problem is small area data. That becomes an issue in cities, and how small is the area and what can you work with. So there are a lot of networks of cities doing very cool things because mayors have the same problems and they like working together, and because they're close to their constituents, and they have, in most countries, not all, in most continents, a good bit of control. There's the C40 group, which is probably the most visible. It was originally funded by Michael Bloomberg, focusing on air quality. They have taken on the whole issue of climate in a very serious way. There's actually mergers and acquisitions going on with C40. They have picked up the network of cool cities, which are cities dealing with the heat questions, and there's a Cities Alliance, which is dealing with sustainability. They're all now part of C40, working together. And there are also a number of public-private partnerships. The Novartis Foundation is working on cardiovascular prevention in cities called Cardio for Health. Novo Nordisk has had a longstanding upstream prevention program, cities changing diabetes all over the world. And so this issue of public-private partnerships that I mentioned in Goal 17 is very real in cities, and cities are a venue where people are really looking at especially chronic disease prevention issues. So, and cities are doing cool things. Just a couple of real quick tour. This is Singapore, but this is biophilic architecture, for those of you that haven't gotten into it. And a number of cities like Milan is reclaiming wetlands around the city in order to stabilize it and create a healthier environment for the city. This is my friend, the transportation and urban planning sector. This is Ciclovia in Bogota. I think all of us in New York now are dodging bicycles, and this is pretty normal. This started in 1974 in Colombia. So you can, and in New York it started maybe when Bloomberg was mayor, which is 12 years. I don't know how prevalent it is in Boston, but the idea here is that spaces are blocked off, the community comes out. It's a major community engagement, community development effort, as well as a place for exercise and reducing pollution and other things. So, and this is another one. This is also in Bogota. This is a pro-poor transportation policy where two mayors are confronted with two options. One is health promoting, which is mass transit. I've not been to Bogota, but this gondola was created to bring the poor people living in the favelas down to a co-opt bus system. The jitney drivers own that bus system now and run it, so they weren't put out of business. And there are bike lanes and pedestrian walks into the city, and they've done studies of not only of pollution, but also studies of absenteeism and work, health status of employees, et cetera. And this is what you might call a pro-poor use of $2.3 billion of a loan from the IMF for infrastructure, which is where the money is, by the way. Compared to Pakistan, the mayor of Pakistan was on a panel with the gentleman who was mayor in Bogota, presenting a similar expenditure of money in ring roads and flyovers in Karachi, Pakistan. So those are real choices and serious money if we get the transportation sector and the infrastructure sector and the other people to think about the healthy options and what they're doing anyway. They don't have to be public health professionals. This is my favorite age-friendly cities. We started age-friendly cities in New York City 2008 with Mayor Bloomberg. And in the city, the neighborhood of East Harlem, I was at the New York Academy of Medicine at the time, had a fantastic WPA public pool. And the kids, as you can see on the left, liked that pool in the summer. They were very busy. And the older people always felt like they were getting killed if they went there. They were interested. And so what we did with Age Friendly was create senior hours for the seniors to come and use the pool. And then the mayor threw, and it apparently turns out these are things that are so interesting. There's a free service of trainers, of professional trainers that the Parks Department offers in New York. So you could get, somebody who's a water safety instructor to come for nothing to the pool. So that person came, and all the elected officials were really excited, and they were there cutting the ribbons and stuff. And about 45 older people came on day one. It was in the newspaper, and the mayor was really happy. And the older women who were leading this said, they had never been to that pool since their kids left home, because they had been taking them there in East Harlem before that, but they had no occasion to go back. And they really liked the water safety instructor. And they thought these hours were pretty cool. And so rather than just having it as a photo event, they got the water safety instructor back every week to work with them. And on the right-hand side, there's an East Harlem group that's called I think they're called I can't remember their name, but they're all women over 65 that are synchronized swimmers. And they're very famous. They come out and, do things around New York. So this was not only community, and they stayed together and would meet and think about other issues that needed to be improved in the community. So it's an example of centering older people around, and many of them have time. And I've said before, if you're depressed about getting public health initiatives started, work with colleagues in the aging community because older people spend local, they buy local, which is economic development, and they vote. And a lot of what we did in health and all was to show people in different council managed districts how many older people lived in their district and how they should pay attention. So this is next steps. I just want to give you the sense on the global side. As I said, urban policy, these are things that the UN is promoting. China has a national urban policy. India has a national urban policy. So it's not just little tiny countries. My guess is, having been in the federal administration and the Clinton administration, there will never be a U.S. urban policy because cities are Democrat and rural areas are Republican. And Henry Cisneros, to his credit, when he was the head of HUD, tried to create an urban policy for the U.S. and it just died aborting. But anyway, that's one of our dilemmas. So let me shift to happiness. I'm going to go back to the original definition. And this is, as I said, this is all conjectural, and I throw it out to you to think about. But it was fun to kind of begin to think about it. So how might we begin to have the word happiness, sort of travel with health, with urban health, going forward? What would that look like? And there is something called the Global Happiness Index, not unsurprisingly. Many of you are probably familiar with this. This is UNDP, which does the sort of annual well-being or annual development report. And very credible folks, very good analytic types. And they're looking at this issue. It's 143 countries. And the country, and they look, I won't go into what they look at. These are kind of things they look at. But the happiest country on the planet is Finland. And in the top 10, 6 of the top 10 are Nordic countries, which have basically extensive social support systems, healthcare, education, social services, et cetera, built into their structure. Back to the trust question, built into this issue of that we're, do you have trust in your government? Do you really think it's working for you? We hear it as a slogan all the time, patient-centered healthcare, public-centered blah, blah, blah. When they say it, you really believe it. Somehow, I was in Finland in early September, and that's my last point I want to share. You really believe that they're saying it. This is another thing. Naturally, there's a Happy City Index, which is provided to you by a nonprofit based in London. They have a wild number of categories and variables and others that they put in. And I listed on the left-hand side, or you can see domination of Nordics, European countries, focused again on this infrastructure question. The highest ranked U.S. city is Boston, followed by Baltimore, probably equally. Really? I talked to a friend of mine about Baltimore. And Washington, D.C., is that really a city? Anyway, so I put that there. And then the next ones in the category, you have to go down to 114, 145, 167, 190 in the U.S. to get cities that meet a certain level of this index. And the index is really interesting. It's a challenge for all of you that are researchers to look at their metrics and poke holes in them and figure out how it could be measured. The metrics for SDG 11 are lousy. They're all economic. So there's a real opportunity there to think about SDG 11 if you're really interested in cities and urban health. And the one quote that was interesting in this write-up of the Happy City Index was Plato. It says, the city is what it is because our citizens are what they are. And so it speaks to this issue of a level of governance, a level of action that really depends really on cities and on people that are living there to move it forward. So what would it look like if we, goes back to this is the multi-level health intervention, what would this look like for happiness? I don't know. I'm just throwing out the challenge to you. But I want to tell you a story to make it more complicated. So I was in Helsinki the first 2 days of September, and we with the Novartis Foundation, which is doing cardio for health with Helsinki as one of the cities. And we had dinner with some of the officials before, and the next day we went and met with the deputy mayor of Helsinki. And he presented to us, and the focus was on AI and digital. And they have an amazing digital capacity within their health sector. They have national identity numbers and everything, so they know where everybody gets health care and what they're doing. And the question was asked, I asked him the question after he talked about it. I said, well, Finland's the happiest country in the world. How do you feel about robots and increasing digitization, he stopped for a minute and he said, well, you know, really, Finns don't really like interacting with other people, so we're really excited about it. And I thought, okay, that was really interesting. I mean, think about that for a minute. If you have this support system, you don't necessarily must rely on human interaction to give you that, right? I mean, it's a really interesting question. So last week at the UN General Assembly, another young woman who is an ambassadorial level woman in the national government who came to this session, and I had met her there as well. And I said to her, I told her the story. And I said, is this true, or was he making a joke? And she said, no, it's really true, and I'll tell you another story. She's Finn. She said when they broke for COVID and when they stopped to the COVID constraints, she said all the Finns took a big sigh of relief and said, now we can go back to 3 meters instead of 1.5 in terms of social distancing. So I think the point here is happiness is quite, as is health. It's very contextual and it's very complex, and it really makes it super interesting. And I would argue that at city level, it's even more fun because the people are there and accessible, and you can get everybody engaged and make a difference. And the last, this is the marketing for the International Conference on Urban Health, being held in Marrakesh, Morocco, November 18 to 21. It's held every year. The theme is climate and cities. So I encourage you, obviously you can't, it's a little bit late to submit something, but icuh.org, keep it in mind for future. And if you have a chance or want to take a vacation in Marrakesh for a couple of days in November, please come. It's fascinating. It is totally interdisciplinary. Half of the participants are from the Global South. You will meet engineers, epidemiologists, clinicians, community members, placemaking folks, et cetera. So that's it. Thank you.
Maybe 1 or 2 questions.
Hi, great talk. I'm actually from Sydney, Australia. Now I live in Copenhagen, Denmark.
Oh wow!
I've seen definitely the shift in trust in the city. But I also, one of the questions I had when I moved to Copenhagen was how much kind of city size contributes to how sustainable a city can be. Because Copenhagen is quite a small city. Aarhus, which was also on the list, is a small city. In fact, a lot of the cities that kind of are in that top bracket are fairly small. And Sydney is huge.
Yeah.
And it was one of the things where everyone's like, oh, we'll just get everyone on bikes and sustainable and everyone can enjoy, you know, the outdoors. But it's impossible in somewhere like Sydney where it's so huge and you have to travel really far distances. And I can imagine in also cities in the US that are really big, where it's also hard to kind of get people to do that, where in Copenhagen it's very easy.
Yeah.
So I was wondering like how much, especially with our growing population, how much is kind of like the city size and impacting kind of this?
Yeah, it's an important question. I mean, I think the fastest growth in cities actually is cities with 250 to 500,000 people. It's not in the big cities. A lot of the larger sprawling ones that are world famous, they're not growing, but they're not growing that much. And the issue for them is to extend. It's really the geographic area, I think, not so much the density on the verticality. But it's an interesting question. I think the bottom line is part of it has to do on the city side, how much authority do local government officials have to make change in their cities? Because if you were trying to be a pro-health elected official or political leader, you could have influence on, you know, small or medium-sized cities. And Bloomberg had enormous influence on New York, as big and sprawling. He won some, he lost some, no question about that. But using the regulatory process framework, if you have it in a city, using the legislative process, again, it depends on how much authority you have. The UN is trying to get nation states to delegate more and give more local authority. Most African countries, the local government has very, very little authority, and that's an issue. They're quite aware of it. Colleagues of mine in Uganda, Kenya, and others are, you know, thinking about that issue. But I think it varies. So it's a really important question. But it all comes back to political leadership, and the city is still a level of government where you can really bring these different sectors together with the community very close to you. And a lot of great experts in urban health in Australia, actually. There's some of the world's best. Any other questions? Yes.
Hi, thank you very much. It was super interesting. I was wondering about the measures that maybe you use in your research, because I don't want to be, I don't know. But I lived in Milan for many years, Italy, and you also show the Bosco Verticale, the vertical booth. Very nice project. But I had the feeling that that city, that is a big city for Italy and probably a small city here in the US, but as any other big city, is getting worse. Can you say that?
Getting worse?
Yeah, it's getting worse. There are so many issues, problems, people. Can we say it's too much? Urbanization. So I was wondering if you, how do you measure this, and if you can spot a trend somehow?
Yeah, I mean, I'm as I said, I'm not a researcher. I was throwing challenges out to you all to deal with the metrics. I think the SDG metrics need a lot of attention. SDG 11 needs a lot of attention. It's just not getting it. Others are. If you look at the precision of some of the other SDGs in measuring, and I think 11 is really a candidate for that. I have there's some interesting questions on the size of cities. I mean, I mentioned the issue of political leadership, but I have colleagues in Africa that have been trying to develop, what do you mean by informal settlements? What's the definition of an informal settlement in a city like Nairobi or some of these huge cities? And the argument being, there's a fantastic center in Kenya, APHRC, which is a big demographic center, research center there, thinking that if you can define what an informal settlement is, you can begin to address the limitations of having it. Like, do people have rights to utilities? Do people have equitable investment in infrastructure? I mean, it's a really, really interesting process. So a lot of, I won't say it's a huge topic, but increasingly a lot of African scholars are really thinking about the question of urban health, especially in academies of science and medicine. There's an initiative to get them involved there. The Ugandans have done sort of 3 National Academy studies in Uganda on urbanization in Africa. And then the other part of it, which I think is connected to your question, is they have, in their report, they came up with the notion, I mean, cities are dependent on areas outside of cities. As everybody comes to cities, the city's there, and people can't eat and they can't get their food and whatever. So one of the things they suggested is if 30% of the GDP of a country is agricultural, in a country that's largely agricultural, then the leadership has to think about parallel development of urbanization and the economic development of rural areas, because otherwise the city won't have food. I mean, it gets too crowded, it gets too big, but it also won't have food, the education. I mean, these are really interesting dilemmas and really interesting things that people working in the space of urban health are really thinking very actively about. So you're asking great questions, but hopefully you'll come up with some of the answers on the metric side. Milan is like the king of transportation policy.
Yeah, but...
Yeah, but...
Then I moved to Pisa a few years ago, and actually I'm working on rural health.
Yeah.
So I'm completely seeing the other side. And it was super interesting because you showed the determinants of health, and you talk about, for example, transportation.
Yeah.
And you show the problems of transportation in a city, but the problem of transportation in a small Tuscan village is that you get the bus to go to the clinic.
Yeah, it's interesting. I mean, I was saying earlier, I think when you present urban health, first of all, for most people, it's like, what? Or, oh, that's interesting, I never thought about it that way, or, whatever. And I will be successful if, when I give a talk on urban health, somebody always raises their hand and says, but what about rural health? That hasn't happened yet. I mean, you're flirting with it, saying, what about outside city? But I mean, the whole global development paradigm is really rural when you think about it historically, and it's very, very difficult to get people focused on cities because it's complicated, and it's interdisciplinary, which is not rewarded. Interdisciplinary scholarship is not rewarded in academic environments. So, good questions.
Right. Let's give one more round of applause. Thank you so much. As you can see, it's a very appealing topic. So
I hope so.
Let me also thank everyone else and people online. I'm looking at the camera, so you think I'm staring in the skies. We won't have a seminar next month, but we have a major program, a symposium called Resilience Through Adversity, named after the famous Dr. Chester Pius, who was the chair of our department many years ago. So to honor him, we are holding the symposium. We'll get more information on our website and through other avenues. So thank you all for joining us. I think there may be still some pizza left, so make yourself happy on your way out. It's still there. So thank you. Thank you.